All right, nursing students, get ready, because today we're going to be breast health detectives, figuring out how to tackle those cases that'll show up at your exam table.
Yeah, that's right.
From the everyday lumps and bumps to the more serious stuff, we're going to break it all down.
We've got your textbooks and the latest research right here.
All ready to help you become amazing nurses.
Absolutely.
Give the best care to your patients.
That's the goal.
All right, so let's start with a case that might seem pretty basic. At first, you've got a patient walking in totally freaked out because they found a lump in their breast.
Oh, yeah.
What's the first thing that pops into your mind as a nurse?
Honestly, the first thing that pops into my mind is that over 80% of breast lumps are benign.
Right.
Like, that's a big number.
That's huge.
That's really important for calming anxieties right away.
Yeah, that's knowledge that has patient whisperer written all over it.
Yeah.
Okay, so let's say it's like a classic case of fibrocystic changes.
Okay.
Our sources say these are so common.
Oh, super common.
Affecting like half of all women.
Yeah, 50%, it's a lot.
Wow.
And here's where like those detective skills come in.
Okay.
These changes are often tied to hormones, with the ups and downs and fluctuations.
Right.
So imagine your patients in their 30s and they're freaking out about lumpy breasts.
Yeah.
Well, you can connect the dots for them, explain that it's probably tied to their cycle, and bam, instant reassurance,
Right. So it's like this monthly hormonal puzzle that we need to help them figure out.
Yeah.
Okay, but the textbook also says that these fibrocystic changes can make it harder to feel for cancerous lumps.
Oh, that's right.
It's like trying to find a tiny pebble in a bowl of oatmeal.
Yeah, that's a great analogy.
Right.
And that's why patient education is really important.
Oh, for sure.
We need to teach them how to do regular self-exams and what's normal for their own bodies.
Got it. So regular checkups, self-awareness, knowing those hormonal patterns, that's all key.
Mm-hmm.
Now, what about those nursing care plan details?
Well, first off, managing their pain-over-the-counter pain relievers can often do the trick. Our sources also mention lifestyle tips like reducing caffeine and salt intake to minimize discomfort.
So it's not just about addressing the physical changes, but also helping them make some lifestyle changes.
Yes, exactly.
That could really make a difference for them.
It's about that holistic approach to care that nursing is all about.
That's what it's all about.
Yeah.
All right, let's move on to our next case, fibroadenomas.
Okay.
Our sources say these are common in younger women.
Yeah, think of them as like the teenagers of breast lumps.
Okay.
A little unpredictable, but usually harmless.
Gotcha.
Often it's a watchful waiting approach, seeing if they shrink on their own.
But what happens when watchful waiting isn't enough?
That's when things get a little more interesting. We can talk about cryoablation.
Cryoablation?
Yeah, which is basically using extreme cold to freeze and destroy the tumor.
Wait, we're talking about freezing a tumor.
Yeah.
Is that really a good option?
Well, like any procedure, it's not without risks, but it's minimally invasive.
Okay.
Meaning less pain and scarring for the patient.
Right.
And that's something we as nurses should be advocating for.
So we're not just following doctor's orders, we're weighing the pros and cons and making sure that our patient gets the best possible care.
Absolutely. And after any treatment for fibroadenomas, long-term monitoring is key.
Right.
We need to be those champions for our patients,
Yeah.
reminding them about follow-up exams and self-checks.
Absolutely. All right, case closed on fibroadenomas for now.
For now.
But let's not forget about mastitis.
Oh, yeah.
Our textbooks paint this picture of a new mom exhausted from all those sleepless nights.
Yeah.
And then bam, mastitis hits.
Oof.
It's like adding insult to injury, right?
It really is. Mastitis is an infection or inflammation of the breast tissue.
Okay.
And it's not just for breastfeeding moms, although that is the most common type.
Hold on, there are different types of mastitis.
There are.
My sister had it after she had her baby.
Yeah.
And she was a mess.
Yeah. It can be rough. So there's lactational mastitis, which is linked to breastfeeding, and then there's non-lactational mastitis, which can stem from things like clogged milk ducts or even underlying conditions like diabetes.
So it's not a one-size-fits-all diagnosis.
Nope.
How do we as nurses tailor our care depending on the type?
Well, for both types, comfort is key. Warm compresses can work wonders along with over-the-counter pain relief.
Right.
But for lactational mastitis, there's like an added layer of support we can provide.
You mean because they're already dealing with the demands of a newborn?
Exactly. Reassurance is huge. We need to let those moms know that it's generally safe to continue breastfeeding even with mastitis and while they're taking antibiotics. And that can be a game changer for their peace of mind.
Makes sense. We're not just treating the infection, we're supporting their entire breastfeeding journey.
Exactly.
Now we've tackled those common benign conditions.
Right.
But there's a more serious case we need to discuss.
Yeah, it's time to address breast cancer, a leading cause of death in women.
And this is where our detective work gets a lot more intense.
It does.
Yeah.
It is. And this is where early detection is so important.
Yeah.
Our sources highlight the power of mammograms.
Okay.
They can spot tumors years before you could ever feel them.
So mammograms are like our secret weapon in this fight against breast cancer.
Exactly.
Okay.
And think about the impact that we as nurses can have on this.
Right.
We're the ones encouraging our patients to get those screenings, educating them about how important early detection is.
Yeah.
We're literally saving lives.
Powerful stuff.
Yeah.
But let's not forget about risk factors.
Right.
The textbooks mention a whole bunch of them.
Yeah, and here's where we really need to separate fact from fiction.
Okay.
Some risk factors you just can't change, like your genetics and family history.
Right.
But there are other risk factors that we can control through lifestyle choices.
So it's not all doom and gloom.
No, not at all.
We can actually empower our patients to take charge of their breast health.
Absolutely. We can teach them about the impact of things like keeping a healthy weight, staying active, not drinking too much alcohol.
Yeah.
It's all about making healthy choices that can really make a difference.
I'm feeling empowered already.
Good.
But let's say the worst happens and a patient is diagnosed with breast cancer. What's next?
Well, after a physical exam and a mammogram, a biopsy is usually the next step.
Okay.
That's where they take a little bit of tissue to look at under a microscope.
Gotcha. So this biopsy thing, how does that actually work?
It's pretty amazing, actually. They inject a dye near the tumor, and it travels to the first few lymph nodes.
Okay.
Then they remove just those nodes to see if there are any cancer cells.
And why is that so important?
Well, it's way less invasive than taking out all of the lymph nodes,
Right.
which means a lower risk of lymphedema,
Yeah.
which, as we know, can be a lifelong problem for patients.
That makes a lot of sense.
Yeah,
So we can really be advocates for our patients and make sure that they understand the benefits of this approach.
exactly.
Okay. And once we figure out the stage of the cancer, what are the treatment options?
Well, it can be a little bit complicated, but basically there are local treatments like surgery and radiation, which target the tumor directly.
Okay.
And then there are systemic treatments like chemo, hormonal therapy, and immunotherapy, which work throughout the whole body.
So it's like a two-pronged attack on these cancer cells.
Exactly.
All right, let's break it down a little bit when it comes to surgery. What are the main things that we should be thinking about to support our patients?
So there's often a discussion about lumpectomy versus mastectomy.
Okay.
Lumpectomy removes just the tumor and a little bit of the surrounding tissue,
Okay.
usually followed by radiation.
And why would you choose that one?
It's a less invasive option.
Okay, less invasive.
Yeah.
Got it. What about mastectomy? When is that necessary?
Mastectomy, which removes the entire breast, might be recommended for larger tumors or more aggressive cancers,
Okay.
or for women with strong family histories who choose a more proactive approach. And it's important to remember that a lot of women choose to have reconstruction after a mastectomy,
Right.
using either implants or their own tissue.
Wow. So many options. It's incredible.
Yeah,
It's like we can help them rebuild their lives, not just physically, but emotionally, too.
that's right.
Okay, so that's surgery. What about radiation?
Radiation therapy is often used after a lumpectomy to get any leftover cancer cells.
Right.
And there's been a lot of progress in this area. For example, brachytherapy, where they put radioactive seeds directly into the tumor site.
Hold on. Radioactive seeds. That sounds kind of scary.
It does sound a little scary, but it means less discomfort for our patients and they recover faster.
Okay, and that's good.
Yeah.
All right, so now let's talk about the systemic treatments. What's the deal with chemo?
Chemotherapy uses strong drugs to kill those cancer cells that might have spread.
Yeah, chemo comes with a lot of side effects, right?
It does things like hair loss, nausea, fatigue. It's a lot to handle.
It's a lot for anybody to deal with.
Yeah. Yeah, but here's the thing. As nurses, we can really be there for our patients during this time.
Yeah.
We can teach them about how to manage the side effects. We can offer emotional support.
Right.
And just celebrate their strength every step of the way.
So it's like we're their partners in this fight,
Exactly.
not just their caregivers.
That's right.
Okay, so now what about hormonal therapy? I remember learning about tamoxifen. How does that work?
Tamoxifen is a type of hormonal therapy that's often used for hormone receptor positive breast cancers.
Okay.
It basically starves the cancer by blocking the hormones that it needs to grow.
So we're cutting off the enemy's supply lines.
Exactly.
Pretty cool.
Yeah.
And what about immunotherapy? That seems to be the newest thing.
Immunotherapy is a game changer.
Yep.
We're talking about using the body's own defenses to fight the cancer.
Can you break that down for me? How does that work?
Think of it like this. We're using drugs like monoclonal antibodies to flag those cancer cells so the immune system can destroy them. Or we're boosting the immune system so it can better recognize and attack cancer cells.
So we're not just attacking the cancer, we're helping the body fight back itself.
Yeah, exactly.
That's powerful.
It is.
But with all of these options, it must be so hard for patients to navigate all of this.
It can be. And that's where we as nurses are so important.
Right.
We need to be their guides, their translators, their advocates, explaining these complex treatments in a way that they can understand, making sure they know the risks and benefits so they can make informed decisions.
It's like we're holding their hands through this whole journey.
Yeah.
But it's not just about the physical parts of treatment, right? There's a whole emotional side to dealing with a breast cancer diagnosis.
Yeah, it really is.
It's not just about treating the physical disease.
Right.
It's about supporting the whole person.
Yeah.
Our sources emphasize that.
Absolutely. Body image, sexuality, femininity.
Yeah.
These are all really personal things that can be affected by breast cancer and its treatments.
Right.
We as nurses need to be sensitive to that.
So it's not just about giving meds and checking vitals. It's about creating a safe space for them to talk about their fears and anxiety.
Exactly. It's about active listening, validating their feelings.
Yeah.
Letting them know that it's okay to not be okay.
Right.
And it's about empowering them to take an active role in their recovery.
That makes sense. We can't fix everything for them.
Right.
We need to equip them with the tools and resources to navigate this whole thing.
Exactly.
What does that look like, practically speaking?
It could be connecting them with support groups, providing information about resources like physical therapy or counseling, encouraging them to embrace those healthy lifestyle choices that can boost their well-being.
So we're like their cheerleaders, their guides, their partners in this whole process.
We are.
Speaking of partners, I'm curious about something we've talked about, the patient's experience. What about their family? Breast cancer doesn't just affect the person who's diagnosed, does it?
You're absolutely right. It ripples outward, impacting their loved ones, partners, friends.
Yeah. And honestly, sometimes those caregivers need our support just as much as the patient does.
That's a really good point. It's like a whole ecosystem that we need to be aware of.
Right.
With all of these expanding responsibilities, it feels like the role of the nurse in breast health is constantly evolving.
It really is.
It's a lot to keep up with.
It is. And that's why continuous learning is so important.
Yeah.
This field is always changing. New research, new treatments, new approaches to care.
Right.
We can't just rely on what we learned in school.
So it's about staying curious.
Yes.
Staying engaged, staying ahead of the curve.
Exactly. Read those research articles, go to conferences, ask questions, find mentors.
Okay.
This is how we provide the best possible care.
So true. It sounds like being a breast health nurse is a lifelong commitment to learning.
It is.
Speaking of learning, I have one final question for you. What's on the horizon in breast cancer research that has you excited?
Oh, there's so much personalized medicine, for one.
Personalized medicine.
Yeah, imagine tailoring treatment to each individual patient.
Based on the genetic makeup of their tumor, that's the future.
So we're talking about like custom-designed treatment plans.
Exactly.
Wow.
And then there are all the advancements in immunotherapy.
Right.
New drugs, new approaches, all aimed at harnessing the body's own power to fight back against cancer.
That's incredible. It's like we're entering a whole new era of cancer treatment.
We are.
Okay, so much to learn, so much to explore. Any final words of wisdom for our nursing students?
Embrace that inspiration.
Okay.
This is a challenging but incredibly rewarding field.
Yeah.
Never stop learning, never stop advocating for your patients, and always remember that compassion is your most powerful tool.
Beautifully said. I think we've covered a lot of ground today in this deep dive.
We have.
We've explored the ins and outs of breast health, from those everyday lumps and bumps to the latest and greatest in cancer treatment.
We did.
And I hope our listeners feel ready to take this knowledge and make a real difference in the lives of their patients.
I hope so too.
It's been quite a journey from becoming breast health detectives.
Yeah.
To understanding the ever-evolving role of the nurse in this field.
It's always changing.
I feel like we've equipped our listeners with some powerful tools.
We have. And remember, you're not alone in this journey.
Right.
There's a whole community of nurses out there ready to support you.
So true. Thanks for joining us on this deep dive into the world of breast health. Until next time.